Please, this is a video on glomerular filtration rate. Particularly, I'll be defining the glomerular filtration rate and giving a brief overview of one of its determinants, that is the filtration coefficient. I'm Dr. Swapnil Parlikar, Associate Professor in the Department of Physiology at Government Medical College, Bhavnagar. You can see this is the tuft of glomerular capillaries, and one arteriole comes into it, which is known as the efferent arteriole, incoming or efferent. One arteriole leaves it, it is the efferent arteriole, which is leaving it. And then it leads to another set of capillaries called the peritubular capillaries. So there are two sets of capillaries, the glomerular capillaries and the peritubular capillaries, and hence it is known as a portal circulation. What is it called? A portal circulation. Portal. Portal circulation. Why? Because one capillary set leads to another capillary set. Glomerular filtration is filtration across the glomerular capillaries into the Bowman's capsule. This one step number one. And when urine is formed, glomerular filtration occurs, and then there is tubular reabsorption. Reabsorption because absorption occurs in the intestines, and reabsorption is across the tubular epithelial cells. There are the epithelial cells lining this tubule across the epithelial cells into the peritubular capillaries. When substances pass in the opposite direction from the peritubular capillaries into the renal tubule, then it is known as secretion. It is known as secretion. Secretion. So the third step is secretion. So urine formation or urine excretion is glomerular filtration 1, glomerular filtration minus tubular reabsorption plus tubular secretion. As you have studied in 12th standard, the glomerular filtration is the first step in urine formation. It is the first step. Filtration across the glomerular capillaries into the Bowman's capsule is the first step in urine formation. And across the glomerular capillaries means across the three layers of the glomerular capillaries, that is epithelium, basement membrane, and endothelium. Now there is a particular definition for it. It is the amount of glomerular filtrate formed each minute by all the nephrons of both the kidneys is called a glomerular filtration rate or GFR. So what is GFR? The amount of glomerular filtrate formed each minute by all the nephrons of both the kidneys. How many nephrons are there in each kidney? You guessed it right. There are 1 million nephrons in each kidney up to age 40, and then they decline by 10% every decade. The other two steps in urine formation are tubular reabsorption, that is passing across the epithelial cells into the peritubular capillaries, and tubular secretion passing from the peritubular capillaries into the tubular lumen. The glomerular filtration rate is known as GFR, and it is the most important index of renal function. When serum creatinine is measured as an index of renal function, it indirectly indicates the GFR, and its value is 125 ml per minute or 180 liters per day. So the entire plasma is processed 36 times a day, and we'll see why this 36 times a day the kidney has to process all the plasma, because it has to maintain, it has to keep the body clean, it has to excrete the waste products in the body. Now this GFR is a product of filtration coefficient and net filtration pressure, which in turn depends on Starling's forces. We'll focus in this video only on the filtration coefficient. The filtration coefficient the capillaries is a product of the permeability and surface area, and it is very hard in the kidneys. So the kidneys filter a large amount of fluid. It is 12.5 ml per minute per millimeters of mercury in the kidneys, and per unit of surface area it is 400 times that of any systemic capillary. Is 400 times that is of any systemic capillary. So permeability and surface area of the glomerular capillary is 400 times that of systemic capillary. Large filtration coefficient. Filtration coefficient multiplying by the net filtration pressure gives the value of GFR. So to sum up, glomerular filtration rate. The amount of glomerular filtrate formed each minute by all the nephrons of both the kidneys. The amount of glomerular filtrate formed each minute by all the nephrons of both the kidneys. 125 ml per minute or 180 liters per day. That is, the entire fluid of the body is processed by the kidney 36 times every day. This glomerular filtration rate depends on the filtration coefficient and the net filtering pressure. Filtration coefficient is a product of permeability multiplied by surface area of the glomerular capillaries, and it is 12.5 ml per minute per millimeters of mercury, and the net filtering pressure depends on Starling's forces. It is 10 milliliters of mercury, which we'll be covering in the another video. So thank you so much for watching my video, and for your patient hearing. Enjoy the day. Thank you so much.